This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch Wisconsin Eye on Spectrum Channels 995 and 363 and at wisi.org.
Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. Joining us for today's media briefing are Governor Tony Evers and DHS Deputy Secretary Julie Willems Van Dijk. Also available to answer questions are Dr. Ryan Westergaard, Chief Medical Officer in the DHS Bureau of Communicable Diseases, and Ryan Nilsestuen, the Chief Legal Counsel in the Office of the Governor. And we'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thanks for joining us again. While things are still tough for so many, and we know we're not out of the woods quite yet, things are certainly looking up. Last week alone, Wisconsin administered more than 260,000 vaccines, and we have surpassed notable milestones with more than 790,000 total doses given, meaning more than 10% of Wisconsinites have received their first dose, and more than 174,000 Wisconsinites have received their second dose and completed their series. And we continue to expand and grow our vaccine program as we have the supply to do so. Just yesterday, we announced our first community-based vaccination site will open in Rock County next week. And in the coming days, we'll be announcing more details about the location and more information on this site. This is the first of several planned community-based sites we plan to open, especially as we receive more vaccine and can continue to expand our vaccination infrastructure. These sites will work in tandem with current vaccinators across the state to help get vaccines to local communities. Our vaccine program is a historic and monumental undertaking for our state, but folks, it's what we said all along. Get Wisconsin the supply and we will get shots in the arms. Because we are all safer, we're all better off, and we are all closer to recovery when everybody gets vaccinated. That's why we'll continue to get shots in the arm as soon as they're available and to continue to work tirelessly to get our state vaccinated. But that does not mean we can let our guard down or give up the strategies we know saves lives. Our fight against this virus isn't over. It's not going away, especially as we see mutations of this virus in our states and other states. While tens of thousands of Wisconsinites are being vaccinated every single day, in the first 8 days of February alone, more than 7,900 Wisconsinites tested positive for COVID-19, and sadly, 159 Wisconsinites died. Now, those numbers are in stark contrast to where we were only a few months ago, but they are still dangerously high. This virus has killed 6,055 of our friends, our coworkers, neighbors, sometimes our best friends or loved ones, and always our fellow Wisconsinites. I've said it before, but here in Wisconsin, we take on the big fights together. And I don't doubt that that is exactly why we're seeing such an outpouring of support from more than 50 groups for our public health emergency and statewide face covering requirement, from the small business community to healthcare providers to education leaders. Because Wisconsinites know that in order to put this pandemic behind us, get back to some sort of normal for our kids and our business and our communities, it's going to take a united statewide effort. That's why I'm going to continue to do what I promised I'd do all along: follow the science, follow the recommendations of public health experts, and do everything I can to keep Wisconsinites healthy and safe. But guess what? I can't do that alone. We need to do it together. During a pandemic, we are only as healthy as our neighbors, our coworkers, and other close contacts. That's why we need everyone, students and parents, workers and business owners, every Wisconsinite, to continue to look out for one another by staying home whenever they can, practicing physical distancing and avoiding gatherings, and of course, always wearing a mask whenever you go out. Wearing a mask is the most basic thing we can do to keep each other safe. If the legislature keeps playing politics and we don't keep wearing masks, we're going to see more preventable deaths, and it's going to take even longer for our state to get our economy back on track. As Deputy Secretary Julie Willems Van Dijk said the other day, it's not vaccines or masks, it's vaccines and masks. Let's count on each other to get through this together. Finally, I want to close today on a call to action. As you know, last week I vetoed AB1 because, frankly, it didn't just fall short, but it would have actively limited the response to the ongoing pandemic at a time when we can't afford to lose any ground. We had a bill that Republicans and Democrats supported, and one that I said I would sign. And with a bipartisan option on the table, Republicans walked away and once again chose to put politics before people and passed a bill they knew I wouldn't sign. Wisconsinites don't care about political points or who gets the credit. They just want to know that their family, their business, their neighbors are going to be okay. So I'm calling on Wisconsinites to join me in urging the legislature to pass the good faith compromise we worked on together and that had bipartisan support, and send it to me so I can sign it. Enough politics. Let's get this done. With that, I will now turn things over to DHS Deputy Secretary Julie Willems Van Dijk. Julie, it's all yours.
Thank you, Governor, and good afternoon, and thank you once again for joining us. As of today, we have administered nearly 800,000 doses of COVID-19, 793,475 to be precise. And as the governor mentioned, 174,482 of those are second doses, which means those Wisconsinites have completed their vaccine series. More than 1 in 3 Wisconsinites 65 or older have received at least their first dose of vaccine. So we talk a lot about numbers when it comes to vaccine, and that is because the more people we vaccinate, the more effective the vaccine will be at preventing illness and protecting everyone in our state. And when it comes to numbers, you may have noticed reports in the last few days about Wisconsin rising in the state rankings when it comes to vaccine administration. Yes, that is very exciting, and I am really proud of the work of our DHS team alongside our colleagues at Wisconsin Emergency Management, the National Guard, and staff from departments across state government and what they have done. I am also extremely grateful for all our vaccinating partners who have delivered those shots to thousands of Wisconsinites. Every week we learn and we get better, and we will continue to do that. I also want to urge a bit of caution. We might go up and we might go down a bit in state rankings, but our goal and what we have focused on since the beginning is getting as many shots into arms as quickly, as safely, and as equitably as possible. As we've been saying throughout the pandemic, we are all in this together, and that applies to our fellow states as well as individuals. In fact, it even applies to countries. This is a global pandemic, and the vaccination effort has to be a local, state, national, and worldwide effort in order to protect all of us. We are proud to be a strong part of that effort, but we are just a part, and we will continue to improve our systems and post our data to do our part as effectively and transparently as possible. And please remember, vaccines are just one tool in our toolbox. To decrease transmission of this disease, we need to keep doing what we know works to stop the spread of COVID-19. Wear a mask and physically distance when you have to go out. Wash your hands and limit your interactions to the people you live with. This is especially important as we face the possibility of increased transmission with the emergence of COVID-19 variants, including those recently identified in Wisconsin. Today, we are adding 681 new cases, which brings our total confirmed cases of COVID-19 to 551,050 people. Our 7-day average of cases is 970. That is lower than it has been, and yet it is also still far too high. Today, we are also reporting 39 more Wisconsinites who have died from COVID-19, which brings our total deaths to 6,094. Our thoughts are with the families and friends who have lost loved ones to this virus, and it is up to all of us to take action to help prevent further loss. So remember, my mask protects you, your mask protects me, and together our masks protect everyone in Wisconsin. Thank you, and we'll turn it back to Jennifer to entertain your questions.
Thank you. And a reminder to maintain audio quality, please keep phones on mute until it is time to ask your question, and please use *6 to unmute your phones. As we do need to wrap it up at about 2:20 this afternoon, in the interest of time and to ensure everyone gets a chance at a question, please one question per reporter per outlet. And we'll begin this afternoon with Rob Sussman from WTAQ Radio in Green Bay. Rob?
Hi, yes, thanks for taking my question. There's been a pretty significant drop in cases lately, and I was wondering if any of the medical professionals had an idea as to why that might be taking place, if that may be an effect from the vaccine, and how we can keep things kind of on that downslope. Appreciate it. Thank you.
I think that'd be a great question for Dr. Westergaard to chime in on.
Yes, thank you. It's a great question. I think the only thing I'd say with certainty is that it's not caused by just one thing. I think having about 10% of the state immunized certainly has a prevention effect, but probably not a large prevention effect. So I think the other things that are at play besides vaccine-induced immunity is, number one, I think people have gotten into a groove and are doing the right things in terms of restricting gatherings and wearing masks. Another thing that I think is happening is what I've described as a positive feedback loop at the local level as it pertains to contact tracing and case investigation. One of the reasons that I think our November wave was so terrible and so deadly was that the epidemic grew so quickly that local health departments' ability to identify cases, do contact tracing, and reach out to contacts to notify them that they're exposed was completely overwhelmed. We weren't able to do those, that local level mitigation. While we were struggling with that, we built up capacity to do it. We got better, we got more efficient, trying to do the best we can. And now as cases get lower, our capacity can actually be used to maximal or optimal effect. So we're actually better able to respond to local clusters, to local cases than we were before, because we've really strengthened this muscle. Our local containment efforts have been improved over time, so that when we do have cases, we can do the things that we needed to do, where that's a stark contrast where we were a couple months ago when we were really struggling to keep up. So I think it's really it's a victory for, victory is a strong word. It's a positive development because of the behaviors of Wisconsin residents in doing the right things for prevention, and our local public health for continuing to respond to cases and contacts and doing quarantine and isolation and case management. So I think it's a little bit of all those things.
Thank you, Rob. Now to Jonathan Neiser from NBC 26. Jonathan?
Hi, yes. So, given that we will get extra vaccines, in the future, especially with, some manufacturers getting approved, and then, also where we're at today, this huge growth, can you give us an updated timeline on, when people can expect to get their dose, even from each phase standpoint? So is that March 1st standpoint looking good? And then also, is the summer, your original projection, is that looking good? Or are we going to get it to the general population sooner? Just give us a timeline if possible. Thanks.
Sure. Again, I know everyone wants me to have a crystal clear crystal ball, and it will never be that clear. But here's some best estimates. So we are getting a little bit more vaccine from the federal government. They report to us that the manufacturers are producing about 10.5 million doses a week nationally. That's up from 10 million a few weeks ago. And so that's what has resulted in our weekly allocation of first doses going from about 72,000 a week up to closer to 89,000 a week. So that's good news, but that's 15,000 extra vaccines a week. That's not going to get us to 7 million doses that we need a whole lot quicker. We also are really appreciative that the federal government has started the retail pharmacy program, which is bringing another 18,000 doses a week into the state that will be administered through Walgreens retail pharmacies. So that's also good news. And as you cited, the Johnson & Johnson vaccine has been submitted to the FDA for consideration, and that decision will be made later this month. And depending on the manufacturing of the vaccine, we'll have additional doses, hopefully, if it is authorized, coming into the state in March. So all of those things are good signs. We do anticipate we will continue to open to the remaining populations in Phase 1B around March 1st. Remember, they are at least equally big as the population of people age 65, so it's going to take, and we will not be done with people age 65. So I anticipate these phases will take another month or two, and then we'll see where we're at with how much vaccine we have. We'll see if we need to open to another more limited phase, or will vaccine production be high enough that we may be able to open up to the broader public. But those are decisions we'll make as we get closer to April and May.
Thank you. Now to Ben Crumholtz from WLUK, Fox 11 in Green Bay. Ben.
Hi there. I certainly haven't heard of this happening often, but is the state tracking the amount of people that are becoming infected with COVID even after being vaccinated? If so, how often is this happening? And if you're not tracking this, why not?
I'm sorry, your question was infected after they've been vaccinated? Yes, that is something we're tracking.
Yes.
That is certainly a question we are tracking in the contact tracing and follow-up that Dr. Westergaard mentioned. At this point, I'm not aware of anyone who has reported that, but we can double check with our epidemiologists and confirm that.
Thank you, Ben. Now to Brittany Slaughter from WAOW-TV in Wausau. Brittany?
Yes, thank you. So we're just wondering, we've noticed in our area that some of the local health departments are receiving more vaccines than others, even if said health department is maybe smaller than another one. So why is the amount of vaccines being distributed to health departments, why is that varying, and kind of how do you guys decide how many vaccines to send to different health departments?
So our vaccine allocation is determined by a weekly survey where all of our vaccinators, not just local health departments, but health systems and pharmacies and long-term care and others who are signed up as vaccinators, request a certain amount of vaccine, and then are allocated vaccine based on a formula that we use. In the early days, the first 5 to 6 weeks of vaccine allocation, we had sufficient supplies of vaccine that anyone who asked for vaccine, we were able to fill their full supply. We ask vaccinators to only request how much vaccine they can give in a week. So part of the reason you saw differences from health department to health department, just as you saw from hospital to hospital, was different entities had the capacity to vaccinate different numbers of people each week. What we realized is that in some communities where there were lots of vaccinators, they may be receiving a disproportionate number of vaccines. And so beginning several weeks ago, we also added a population factor into our formula. So now we are allotting vaccine proportionate to the population within a community. And so, again, it's a blend of how many vaccines the vaccinators can give, and also working to provide an equitable distribution of vaccine based on geography across the state.
Thank you, Brittany. Now to Stephanie Hoff from WIS Politics. Stephanie.
Good afternoon, and thanks for taking my call today. My question is for the governor. I'm wondering, how are you participating in President Biden's visit next week? And did he give you any heads up that he was going to come?
Well, we found out today, and frankly, I'm not sure if I'll be present at that event or not. The most important thing I'm doing that day is giving my budget address, which I'll continue. Which I will give on the 16th, but it's we knew about it a little bit before it was announced, and we're looking forward to welcoming the President of the United States to the great state of Wisconsin. It's always a pleasure to welcome and have a president in our state.
Thank you, Stephanie. Now to Amanda Quintana from News 3 Now, WISC in Madison. Amanda?
Hi, yeah, so we've talked about how difficult it is to plan ahead, both at the state level, when the federal government is not telling you guys how many doses are coming until right before they arrive, and then the same with hospitals, finding out maybe on Friday what they're getting on Monday. So is there any indication that this will change, that they'll get a bigger heads up anytime soon?
Well, Amanda, that's a great question, and I have good news. The federal government has given us a 3-week allocation last week and then the following 2 weeks. And so that survey that I just mentioned that went out to vaccinators this week asked both how many doses they could use this week and how many doses they could use next week. And when we make our notifications at the end of the week, it will include an allocation for them for both the following 2 weeks. So that will begin to extend at least 2 weeks at a time that people can plan. And we're hopeful as we get longer and longer planning trajectories from the federal government to extend that same extended trajectory to our local partners.
Thank you, Amanda. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Hi, Governor, have you talked to legislative leaders about a new COVID-19 relief bill since Friday? And do you think it's realistic to believe that we will have state COVID-19 relief passed before the riskiest part of the pandemic is over?
Yeah, great question. And I have not personally done that. I know staff members have interacted with legislative leaders and others about this issue. I'm real hopeful that, everybody understands, especially the people in Wisconsin that work outside of this building, the state capitol, get it that the best type of legislation is legislation that all parties agree to. And we know what that is. And so I'm hopeful that the legislature will take another crack at this in the near future, and we'll find a bill on my desk that reflects what we had agreed to in the past, what deal we had going with the state Senate, and we could move forward as a state. I think it's important for the people of Wisconsin to get it, that the political leadership of the state can work together. And we did. We had a full bill that included over 20 issues that could have been agreed to and was agreed to by everybody. Unfortunately, that didn't happen. I hope it will happen in the future.
Thanks, Molly. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline?
Hi, I was just wondering if you could provide more details about that second case of the UK variant that was detected over the weekend in Waukesha County. For example, do we know how the individual may have contracted the new strain? Did they travel internationally? And then is there concern that this case could then cause community spread? Thank you.
Again, I'd like to turn to Dr. Westergaard to respond to that question.
Sure. I don't have additional information about the facts about the individual case in question. What we can say about the possibility of community spread is that I think the likelihood is high, if not necessarily from this particular case, but through the amount of interstate travel and international travel that is still happening. As we mentioned in the press release today, we as all states in the U.S. are able to do the whole genome sequencing that's necessary to detect novel variants on a rather small minority, so less than 1%. So when we find a case, again, we're back where we were with diagnostic testing many months ago, where we're detecting a tip of the iceberg, and it's likely that there are other cases that have not yet been detected. What we've heard from other states that have detected a larger number is that a substantial number of them have not had international travel. So that is evidence that there is community spread of these novel variants. So the unanswered question is, how widespread is community transmission of the novel variants? It's not necessarily, it's not a given that they're going to become the predominant strain, but many people who have observed the spread of these in other settings have said that the likelihood of that is reasonably good. So it's the lesson for all of us who are living in Wisconsin is that we need to do all of the things that we know how to do to prevent the spread of all COVID-19. And that's the only way to minimize the community spread of novel variants. It's also the way to prevent the emergence of new variants, because as time goes on, as the virus continues to replicate and spread, the risk of mutations, of evolution of the virus is going to always be present. The only way we can stop that is to stop the virus from spreading altogether. And that uses all the combination of vaccination for as many people as we possibly can, limiting gatherings and wearing masks. So the strategies remain the same, but there's a new element that makes the stakes even higher than it was before to make sure that these potentially more transmissible variants don't gain a foothold and become the predominant strains.
Thank you. Now to David Walbrook from the Wisconsin State Journal. David?
Yeah, thank you. I was wondering if you could go a little bit deeper on giving us kind of an update of the situation. We've got fewer cases on average than we've had in about 5 months. We have a positivity rate of about 4.1%. We have fewer hospitalizations, which are all good. But on the other hand, we have the second case of the variant, and we have a lot of uncertainty out there about how effective these vaccines are against variants. What situation are we in? How would you characterize it?
Well, let me start with that, and then I'll turn to Dr. Westergaard to add on. You know, if today I'm happy to report a 7-day average of cases at 970. It's the first time since September, I think, we've been under 1,000 cases per day. And so that's really good news. On the other hand, when we were on the upslope of this curve, and we were hitting 970 cases a day, we thought we were in dire straits. So it is all relative, and as we've said, this is still far too high a rate. And so I think that is a really important piece to keep in perspective. And it is also incredibly more important to keep in perspective in terms of the variants. So Dr. Westergaard, would you comment particularly about vaccines and the variants?
Sure. I guess just as we talked about before, the curve going, getting lower is a function of a number of things we have going in our favor. There's protection from natural infection that we know pretty confidently now that if someone is infected with COVID-19, they're protected from somewhere between 3 and 6 months at least from subsequent infection. And then we know vaccine also induces immunity. So those, in addition to the prevention strategy that everyone is doing, has put us in a relatively good position of fewer cases overall. Now, we're very vulnerable, and I think the risk we really need to take the risk seriously that this progress can be undone because of novel variants. And what we've learned, particularly with this B.1.1.7 strain from South Africa, is that those things that we counted on, the ability of antibodies that the body generates in response to natural infection, may not neutralize the new variant. It's meaning we don't have protection from natural infection in the way that we expected to with the normal virus. There's also emerging data that one of the vaccine candidates may not offer the same protection against that variant. So we're in this position right now where we are made a lot of progress, but we're also highly vulnerable to see some of that progress undone if we take our foot off the gas, if we let the virus spread and the risk of the introduction of novel variants takes hold. So I think we should be pleased with the progress we've made, but we should be vigilant and really take seriously the risk that an additional wave of infections could occur. So we are not out of the woods yet, and the novel variants are a big part of why we need to remain vigilant.
Thank you, David. Now let's go to Isabella Holsizer from News 8 in La Crosse. Isabella? Again, Isabella Holsizer. Okay, we'll move on then to Todd Richmond from the Associated Press. Todd?
Hi there. I'm seeing reports today that a number of pharmacies, at least around the Dane County, South Central Wisconsin area, saying that they are not getting any vaccine at all anymore for at least this week. Do you know what's happening there?
Yeah, I know exactly what's happening there. We had 505 vaccinators ask for nearly 290,000 vaccines. And so we had to make a lot of tough decisions. And one of the tough decisions we made is that anyone whose allocation would have been less than 50 did not receive vaccine. And so many of the pharmacies can only accommodate vaccinating a smaller number of people and in a week, and so therefore I know a number of pharmacies were not able to get vaccine. Again, it's an unfortunate situation. I'd love to remedy that. I'd love to have vaccine in every single pharmacy in this state, every local health department, every clinic, but given the amount of vaccine we have, we just can't get it everywhere. And then the second thing I'd say about that, Todd, is it also goes to making sure that we're distributing the vaccine equitably across the state. And so we have a very high number of vaccinators in Dane County, which means that not all of them are going to get vaccine because we need to save that vaccine and send it to other parts of the state.
Thank you, Todd. Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you very much. I actually think this question may be for all three of you. With the vaccine, the lower spread, and so on, nonetheless, it seems like we're going to be living with the virus in some form or another for a pretty long time. It's not just going to go away. So I'd like you to share your thoughts on what living with the virus as part of the world we're living in now is likely to mean in concrete terms, not just in the coming months, but even years. Thank you.
Well, I'll start out and give my 30,000 foot level. I think most people in the state of Wisconsin and in this country understand that we do need to wear a mask. We do need to be careful. We do need to have physical distancing, and that will continue for some time. And so I think people understand that. Where I think the lessons we learned is that we've all have to adapt in a relatively proactive way. I know being outside when it's below zero isn't the easiest thing for most people, but I think we're also accustomed to being outside once it gets warm and getting fresh air and getting exercise. And so, just from a global point of view and just my family's view also is that we've learned how important it is to get outside and be in fresh air as often as you can. Now, that doesn't answer the question how our economy's going or how many viruses there are out there, but I just think this has talked to us in a way that we are now in a different place as a family, and I think other families are the same way. Is that we need to make sure we're safe and healthy, but we also want to make sure we get outside and enjoy Wisconsin. I'm glad we're in Wisconsin in this pandemic and not in an area where you can't get outside that often.
I think what I would add to that is that the real key to this, as Dr. Westergaard mentioned, is getting transmission so low that we don't give the virus lots of opportunities to continue to mutate. And that is what is key here. And that is why it is so critical at this juncture in the pandemic that we, as Dr. Westergaard said, don't take our foot off the gas, that we are vulnerable now. And so we can get to a place where the pandemic and the virus is fairly well under control, but it won't happen if we don't do those things. So we got to get transmission very, very low. The other thing is science will continue. We will continue to evolve vaccines. We will continue, we always assumed that we would need booster shots to continue to adapt to how COVID-19 evolves, just like we do with influenza vaccine and other viruses. And so the science will follow this. And I think a lot is left to be seen about how we all learn to interact together, how, masks may become a much more common thing in society when you're out and about. But again, it's all about let's get transmission low, very low, so that this virus doesn't have more opportunity to mutate.
I think I'd add one additional piece to that about what will it look like if we fail to eradicate the virus, and I think that's likely. We're not going to get rid of the virus completely. The first SARS, in 2003, we think went away. That may not be feasible. We may have this virus circulating at some level in the human population forever. But in that regard, we should think about vaccines in a different way than we think about other vaccines. For example, influenza. Influenza, we struggle to get much more than 50% of people vaccinated for influenza. One of the things that we've learned very strikingly about all of the vaccine candidates for COVID-19 is that even if they're not 100% effective for preventing transmission, they are remarkably effective at preventing severe disease and hospitalizations. So if we can get 90% of people immunized for COVID-19 in the coming year, even if it continues to circulate at a low level, we're going to save lives. And we should think about that. The high level of effectiveness for preventing severe disease from these vaccines could really transform what life is going to be like in the next couple of years. We need to do all the things we need to prevent transmission, but vaccination itself, if we can get enough people, we could make hospitalizations and deaths very, very rare from COVID-19, even if we don't completely stop transmission in the community. So that's something that should be a shared goal of getting very, very high levels of immunization coverage in the next year.
Thank you, Eric. Now to Chuck Quirmbach from Milwaukee Public Radio. Chuck?
Good afternoon. Maybe for Dr. Westergaard, but if anyone else wants to respond as well. A UW-Madison lab is doing genome sequencing of the variants. How important is that to public health?
Yeah, it's very important. So the whole genome sequencing that we mentioned, that is really the only way that we will get information about how the novel variants, so the new strains, if you will, of the SARS-CoV-2 virus, the virus causes COVID-19, how many of them are occurring in Wisconsin, and how and where exactly in the state they're occurring. So we currently have 4 labs in Wisconsin that are doing that kind of work, including both of our state public health laboratories, the UW-Madison Research Lab in the Gunderson system in the La Crosse area. We are trying to scale this up. We're actively seeking more funding, more supplies, more staff to do this, because it's going to inform how we understand transmission of the novel variants in the future. So it's a very important tool that I think will become more important as time goes on. Here in Wisconsin, I think we've got a good infrastructure to do that part of the investigation and response pretty well. And now there's national interest in trying to get more resources to do that on a larger scale, which I think would be resources well spent.
Thank you, Chuck. Now to Mary Pouch from WQOW-TV in Eau Claire. Mary?
Hi, my question goes back to the variant that was found, the second case. Do we know where that variant was found, what county? And is it at all related to the first case that was found here in Eau Claire County? Thanks.
Dr. Westergaard?
The second case was tested in a resident of Waukesha County, and we don't know additional information about travel history or exposure history. That's being taken care of by the local health department. So no other additional information at this time.
Thank you. Now to Emily Davies from WSAW-TV in Wausau. Emily? Emily Davies? Okay, moving on to Kent Wayne Scott from
Hello, can you hear me?
Yes, now we can. Is this Emily?
Oh, sorry. Yes. So my question is in regards to the federal retail pharmacy program. I understand Walgreens has been identified as Wisconsin's pharmacy for that program. And then on February 13th, it's going to be starting with 17,000 additional doses statewide. And as of Friday, I understand that it wasn't known which locations that would be getting those doses. Do you have a better understanding of which locations for Walgreens that will be allocated to?
Yes. We've received a list of the Walgreens retail stores that each of them will be receiving about 100 doses. So I believe it's around 175 stores across the state that will be receiving them. I believe if you go to walgreens.com, they have a place on their website that you can log in and register, and I'm not sure they're accepting appointments yet for the Wisconsin stores. My understanding that would begin Wednesday or Thursday of this week. So that is the process by which I understand Walgreens is accepting appointments.
Thank you, Emily. Now to Kent Wayne Scott from WISN. Kent? Kent Wayne Scott?
Hi, yeah, sorry. I know you've talked about the equitable distribution of the vaccine on a geographic basis. Some of the larger healthcare systems, UW Health, for example, has suggested that we need to do a better job of distributing vaccine that takes into account how many people a vaccinator is serving. Does the distribution system need to be improved to better account for the larger demand or larger number of patients being vaccinated?
Well, what I would say is we're constantly working on improving the distribution system and responding to what we're seeing in the data. Later this week, we'll be releasing data based on distribution by county and also by race and ethnicity, by age, by sex. And so these are all data that we'll continue to look at to inform our allocation. But the reality is the state does not hold proprietary data from health systems about the percentage of their patients that are of a certain age or a certain race or ethnicity or a certain disease status. And so we're not in a position to allocate based on those kind of data unless health systems want to get together and share that kind of data with us. So we will do this based on geography. What I can tell you is Dane County is doing quite well, and we're doing a really great job at vaccinating our people 65 and older. So I suspect some of those UW patients might be getting their vaccines through other mechanisms as well, too.
Thank you, Kent. And we have time for a couple more questions, and we'll continue with Alejandro Riano from Latin Independent News. Alejandro. Once more, Alejandro. Okay, moving on then to Jessica Van Egren from Up North News. Jessica.
Yes, I had a question or maybe a clarification I wanted to ask Dr. Westergaard. When you talked about the virus variants and the available vaccines, you mentioned that there was emerging data on I believe one of the vaccines that you said it might not be as effective with with the variant found in South Africa. Should we be concerned about that, or does just simply being vaccinated and drawing down the transmission rate, is that still, I guess, the most effective method? Because I guess I foresee some people being concerned that they might be receiving the brand that isn't, effective against a certain variant. So if you could comment on that. Thanks.
Yeah, thanks. It's a very good and important question. And we have a lot more to learn. What we've learned about that topic is that one of the vaccine candidates that's not yet authorized in the U.S., it's the AstraZeneca Oxford University one, which was approved in some European countries, but has not yet been submitted for emergency use authorization in the U.S. They did their large phase 3 clinical trials in numerous countries and found different estimates of effectiveness in the South African arm of the study compared to the trial that was conducted in Europe. And the hypothesized reason for that is that 90% of the cases that occurred in South Africa were this variant. There's other laboratory-based research showing that the antibodies that are induced by vaccines may not protect as well to that variant. But those are sort of test tube types of studies. We don't yet have data to feel concerned that the two vaccines, the mRNA vaccines that are used in the United States, we don't have any evidence that they are not as effective against that variant. So right now, I think people are cautiously optimistic that the level of antibodies generated by at least the first two vaccines that are in authorization might be good enough to protect against all the known variants. That's sort of what I've heard from national leaders in vaccine science, but of course we don't have direct data. We haven't done the clinical trials to compare effectiveness in that same way that the AstraZeneca vaccine done. So there's really a lot that we still need to learn about. So I would characterize it as that there's some reason for concern, but an overwhelming reason for confidence in the vaccines that we do have that seem to offer really robust protection in the trials that have been done so far. So it's that's really all the best we can say is that we need to learn more, but we're cautiously optimistic that our vaccines that are being used are broadly protective against all the known variants.
Thank you, Jessica. And our final question this afternoon belongs to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thank you for taking my question. Was wondering for the governor, how much of the long-term care funding announced today comes from Medicaid expansion dollars?
The amount, I think, is 140 million, if I'm not mistaken. And I don't know exactly. That's difficult to say that the X revenue from whatever source, whether it's Medicaid expansion or not, is going to be turned around and helping to subsidize another area of the budget. So I don't know the answer to that, but all I know is that Medicaid expansion is something that's very important to the state of Wisconsin. And also the increase in funding to our nursing homes is similarly important. So we're going to prioritize both of them.
Thank you, Sean. And that concludes today's briefing. Reporters who did not get to ask a question can send your questions to DHS Media at dhs.wisconsin.gov. And for more information on COVID-19, please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Thank you and have a good afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.